ACL surgery is for somebody that have an instability for the knee. ACL is defined for anterior cruciate ligament. It is a ligament inside the knee joint, in the middle of the knee, inside there, and it's stopping the tibia moving forward in relation to the femur, and that's its purpose. So if that tendon in the ligament in the middle in here, the ACL is ruptured, and sometimes we have to reconstruct them to make patient's knees more stable. And if that knee is not stable in the long run, we can have more damage within the cartilage and the meniscus within the joint, and can lead to osteoarthritis. There are many different types of ACL surgery, it depending on the choice of the graft that we're going to use, whether that is coming from our hamstring, that coming from your own body, we call that the autograft. Or it could be used, we could use patella tendon, which is in the front of the knee. Again, there is an argument and debate between which type of graft is better, but it all depends on what your surgeon are used to and what different style they have been taught and different mechanism of them to fix that ACL graft. And there are different type of ACL surgery. Also, in some cases, we can use what we call allograft, which is a graft that is from a donor. For that, then it will save us to harvest the tendon from the person. This is a different type of surgery that we can do, and especially for patients that require early rehabilitation and early return to sport, we want patients to have a autograft as is possible, and actually we would like to pre-stretch that graft, and that would make a difference in rehabilitation. And the technique depends on how the surgeon does the surgery for you. Preparation is extremely important prior to ACL surgery. You need a very good physiotherapy and very, very good range of motion before we undergo the surgery. And the muscle function is extremely important also. We need to make sure that your muscle is there firing and working, and the knee is in the optimal condition before we do surgery. For myself, I tend to have a specific protocol to get my patient to stick to before we do the surgery. We will look into supplementation of nutrition supplement, and also we look for specific exercise to stimulate the muscle to work, to grow, and to make sure they can withstand that surgery. Intraoperatively, it's also important to choose the surgeon that will be able to use a technique that allow you to rehab quicker. And also postoperatively, some surgeon will choose to use a brace, and some surgeon will choose not to use a brace. But it all depends on the technique of the surgeon. But more importantly, it's a postoperative recovery. Again, nutritional supplementation is extremely important. Cold compression therapy also really help as well. In combination with that, we tend to give patient an electro muscle stimulation to allow those muscles not to waste away and to enhance that muscle to recover quicker. With all these extra adjunct to help the patient to recover, we need to make sure the optimization of pre-op, intra-op, and post-operatively to achieve a great outcome. ACL surgery is a relatively simple and routine surgery, especially nowadays we can do this surgery under keyhole, so it's arthroscopic surgery. The risks are much smaller than open surgery. Of course, this surgery has to be done in theater with cover of antibiotics to reduce the chance for infection. So in terms of immediate surgical risk, the risk is very small. Of course, the standard risk of bleeding, infection, and sometimes the body did not pick the graft that we use for that ACL is possible. The other more specific risks for ACL surgery is stiffness. The knee can become very stiff, and sometimes the scar tissue form internally, stopping the knee to completely straighten, or what we call hyperextension. Now, these are possibility and a common risk to happen, but usually with good physiotherapy and good post-operative management and intraoperative surgical technique, These will be minimized. But again, it's very difficult to predict how the body will heal. Some people will form more scar tissue, some people will form less scar tissue. But all in all, we have to be very careful and work together with rehab specialists, so therefore we can achieve the best outcome. Absolutely. ACL tear doesn't always mean surgery. I have successfully treated many patients without surgery. We can use, if we manage to pick up a patient early enough, we may be able to treat them with a specialist brace, such as the one that we got here, the black one. This is a special design brace to stop the tibia at the bottom slide forward in relation to the femur. By applying that special brace, we can actually reduce the ACL back to where it was and allow the body to heal functionally. Now, these are very cutting edge new treatment, but if we manage to capture the patient and diagnose that patient early enough, therefore urgent early MRI is extremely important to have that diagnosis. Conservative management of a dynamic motion brace with the correct pressure is very possible. Of course, if it's slightly later with a specific type of tear, instead of reconstructing, replacing the ACL, we can actually repair that ACL with some sort of internal bracing within that joint. The results are quite successful on a specific type of tear. So I think the key here is that, yes, there are more than just operative treatment for ACL injury. I think the key is to get early diagnosis and to speak to the correct surgeon. So it depends what happened on the demand of the individual. If somebody that is a very active, got very high demand on the knees or the joint, they actually might not need any surgery at all whatsoever. Physiotherapy is an extremely powerful tool to balance, to build your muscle on the quadricep muscle as well as your hamstring muscle. If your quadricep muscle and your hamstring muscle, which is one in the front, one at the back there, is very strong, it hugs around your knee. By hugging it around your knee, your knee will become more stable. So therefore, they are quite common that for some very elite and very good athlete that got very good muscle tone, they do not actually need any surgery at all. Now, so the speed of treating that ACL injury depends on the need of that patient. I think it's very difficult for me to say that, well, all patients need to have surgery and all patients need to be braced. I think, again, the key here is early diagnosis and early discussion with an expert to find out what is going on inside that knee. So it will be a discussion down to, shall we fix it? Shall we rehab? Or shall we try to repair it?